Welcome to another edition of Web Chat with the Warden. I'm Chris McMillan, joined by Oxford County Warden David Mayberry. How are you doing? Enjoying the new year?
Well, very much so. Nice cool days, lots of snow, and actually pretty good to get around. So far winter has been fine.
You've already had one council meeting in 2018, and one big item that was approved at County Council and then essentially approved in Elgin St. Thomas was the merger of the public health units. So for people at home, what is this going to mean for them? Will level of services change? Will there be any real change day to day for the people who use Oxford County Public Health?
I think most people won't notice hardly any change at all. Our hope is that, in fact, the service will be enhanced, and because we'll have to be providing for a larger area, we should be able to maybe attract some expertise in areas that right now that we don't have, and I'll leave that up to the more medical people to figure out exactly where we may be lacking or where we could sort of enhance some of our services. But for the vast majority, the services that we're providing now are the services that either are mandated or the county has believed are important. And as we discussed the merger at County Council, the largest issue was, can we continue to provide the type of service that people are used to and the quality of service that we want the people of Oxford County to have in a larger unit, and we believe we can. We think that particularly with the way the province seems to be leaning towards larger public health units, that this is an opportunity for us to grow a little bit, but also to maintain sort of local control. And I think that's if I had to be completely open about it, I think that was probably the largest concern of our council, was would we be able to maintain control over the local public health. And I think we realized that merging with another similar sized unit is probably, where we would have sort of 50% control, is probably a better deal than trying to merge with the whole region where we might have 10% control. And so I think from that perspective, I'm fairly satisfied that we've kind of got the best of both worlds. We've got the size that we need for efficiency of scale, and we also have the ability to pretty much determine and shape the kind of public health program that we want in Oxford and in Elgin.
Now, given that both councils have approved this, is this kind of a foregone conclusion at this point? Is there any type of roadblocks still left, or is it just more of a formality from the province?
Well, of course, the Ministry of Health and Long-Term Care can do whatever they feel like. They're actually in control. But our request, being that it's a joint request, that we both support the request, that we've filled in dotted all the I's and crossed all the T's that they've asked us to. I would expect that this is sort of a work it through the system, and eventually we'll get our approval, and we're hoping that we'll have kind of approval by so that we can emerge by the 1st of May, and then we'll actually start the more difficult part, which is actually merging the services and staff and all the different computer programs and all that sort of stuff that we need to bring together into a single entity over the next year or so after that.
Warden, just in terms of completion date, if all goes well, when will the new health unit or the merger kind of officially take place?
I think from our perspective, we're hoping the 1st of May. But that's sort of the joining of the two boards, the joining of the two services. The reality is that you have to kind of work your way through all of the work, all of the staff, all of the programs that they do now, and kind of jig them all just a little bit so that they align properly with each other. Most of them, because they're provincially mandated, will be very, very similar. There'll be small nuances of difference that we need to work on. But I think that's we're hoping that will be a process that maybe take maybe a year, maybe at the outset, or at the outer limit, maybe 18 months. But we would hope to have all of this combined into one harmonious public health unit, certainly a year and a half from now.
Anything else you wanted to add?
No, I think for the people of Oxford County, this is probably a positive move. I'm looking forward to seeing how it transpires. We will very shortly be creating, when the ministry approves it, transition board, so a group that will actually help lead us through this amalgamation or merger. And then after that, we'll get into, and I'm hoping that work will be kind of primarily, at least the leadership part of that work. I'm hoping by the end of the year or early next year, we'll be able to elect or appoint the sort of the go forward Board of Health for the next the next term of council.
Absolutely, and make sure to follow all of that and all the progress on Heart FM News. I'm Chris McMillan, joined by Oxford County Warden David Mayberry, and make sure to join us again next time for another edition of Web Chat with the Warden.